Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. It is October 17th, 2024. Today we will be talking about the presidential election. Before we get into that, some health affairs stuff to highlight. For Health Affairs Insiders, on October 21st, next Monday, we are hosting a journal club examining the timing of new drug launches in low, middle, and high-income markets with Olivier Wolters. This week, we published an article from M. Greg Bloch titled Ethics and Health Systems Change and Introduction on Health Affairs Forefront. It is the first article in a new Forefront series on the ethical implications of developments in the business of healthcare. We invite readers to submit articles on that topic through our submission portals, which listeners can find in the show notes. And as mentioned, on our special bonus episode yesterday with Michael Gerber, we are offering a collection of articles related to the health-related topics related to the 2024 presidential election. And if any of you are keeping score at home, I did not change that copy from the day before. Check out our collections page. You get access to 32 articles in total. Actually, that's inaccurate. We added a new section on home care. In addition to the sections on drug spending, markets, the ACA, reproductive health, and that there might be other one in markets. Did I already say that? Anyways, at least 10 articles are paywalled, and you get access to that. Today on the program to talk about the presidential election, we have Ellen Bayer. Ellen, welcome back.
Thanks. Great to be here, Jeff. Thank you.
Yeah, so looking forward to this conversation. I don't know about you, but I feel like I have not heard a lot about the election as I had in previous times. I don't know if you agree or disagree.
Well, I feel like I've been hearing a fair amount. As health policy wonk says, we're interested specifically on where the campaign stands on health policy issues. And there's so many of those, we couldn't possibly cover all of them in the time for this.
I'm a single issue voter myself. So and my issue is that no movie should be longer than 120 minutes. So any candidate that gets that over the finish line is where I'm going.
So perhaps today we can focus on, three big health policy issues that have been topics of discussion in the campaign.
Yeah, that'd be great. Again, maybe I'm not as in tune to it. Maybe I'm trying to not even pay attention to the presidential election. But yeah, educate me on what is being talked about from the healthcare aspect of it.
Okay, so first on the issue of prescription drugs, and before we get into what's being talked about on the campaign trail, I just want to point out that both candidates have a track record on this issue. As we talked about in an earlier episode of this podcast back in August, there are several provisions in the Inflation Reduction Act of 2022, which was a major achievement supported by the Biden administration, that were aimed at lowering the cost of prescription drugs in Medicare. And back in 2022, Kamala Harris actually cast the tie-breaking vote for the IRA in the Senate. And among the many provisions of that law that affect prescription drug prices is one that we talked about back in August that authorizes CMS to negotiate with drug manufacturers to set a maximum price for certain brand name drugs that account for the largest share of spending in Medicare Part D. There's also a provision that sets a $35 cap on Medicare beneficiaries' monthly out-of-pocket costs for insulin, which took effect in 2023, and also set a cap on beneficiaries' annual out-of-pocket costs for prescription drugs, and that maximum will be $2,000 a year starting in 2025. So Kamala Harris has said in the campaign trail she wants to speed up those drug price negotiations, which under the IRA takes place in stages. In the first stage, the maximum prices for the first 10 group of costly prescription drugs doesn't take effect until 2026. But Kamala Harris has said she wants the drug prices to come down faster than they will under the IRA. She also wants to extend both the $2,000 annual out-of-pocket cap for all prescription drugs, as well as the $35 monthly out-of-pocket limit for Medicare beneficiaries for insulin to all Americans.
Yeah, and for listeners, we do have a series on the Health Affairs website called The Eye on the IRA. Readers and listeners can check out what content's on there. Also, we've had a lot of different podcasts on this subject with Stacey Dusetzina and Rachel Sachs on prescription drug costs and the IRA and the first round of drug price negotiations. So people should check those episodes out and that section. Back to the current day. Ellen, what do we know about how this activity might affect the average consumer?
Sure. Well, of course, it's hard to say, but there have been, a few analyses done. I mean, on its face, it seems like extending those out-of-pocket limits to all Americans could bring some substantial savings for consumers. There was a KFF analysis done that actually suggests that extending that $2,000 cap to people with private insurance actually wouldn't affect very large percent of the population because most people with private coverage actually don't pay over $2,000 out of pocket a year for prescription drugs. And some critics have said that this kind of approach could lead insurers to kind of reduce the coverage for other types of health care. Or it could, some people have said that it would destabilize the private insurance market. As I said, it's really hard to predict at this point.
So where does former President Donald Trump stand on the topic of prescription drug pricing or drug pricing in general?
So as far as Donald Trump's record, when he was running for president in 2016, he said that he supported letting the government negotiate on prescription drug prices directly with pharmaceutical companies, which was a policy that was subsequently included in the IRA that was enacted in 2022, as we were just describing. Back then, there was a bill, back when Donald Trump was president, there was a bill being considered in Congress, H.R. 3, that among other things included a provision that would have allowed CMS to negotiate with drug manufacturers. But Trump opposed it at that time. The House passed the bill, but it was never considered in the Senate back then. As president in 2020, Trump signed an executive order that was intended to make sure that Medicare wouldn't pay more for prescription drugs than the prices that are paid in other developed countries. This was known as his most favored nation approach. It would have set Medicare payments for prescription drugs covered through Medicare Part B based on the lowest prices for them in other high-income countries. But several drug companies and industry groups filed lawsuits to oppose the policy, and eventually a federal judge stopped it from taking effect. And under the Biden administration, the policy was rescinded. During his presidency, the Trump administration established a time-limited involuntary model that allowed participating Medicare Part D plans to limit beneficiaries' monthly insulin cost to $35. In his campaign this year, Donald Trump has called out the high price of prescription drugs, but he's no longer talking about the most favored nation approach as the solution. The Republican Party platform this year, in which he played a major role in developing, says healthcare and prescription drug costs are out of control and that Republicans will increase transparency, promote choice and competition, and expand access to new affordable healthcare and prescription drug options. And the platform pledges to protect Medicare and ensure that seniors get the care they need without being burdened by excessive costs. As far as I know, the Trump campaign has not provided details on how those goals would be accomplished.
All right, well, moving on from prescription drug prices. Again, I'm a single issue voter, but another issue that's taken in the healthcare space a little bit of prominence is the topic of home healthcare, which can potentially have some high costs to cover. How have the candidates discussed that topic?
Absolutely. That's been a big issue in the campaign. Given the aging of the baby boomers and changes in medicine that have allowed millions of people with multiple chronic conditions to live at home, there's a tremendous demand for paid home care services. But there's been also a huge shortage of paid home care workers for decades now. And the cost of home care is much higher than most Americans can afford. Medicare coverage of home health is extremely limited, and it's only available for limited periods for skilled nursing and therapy services. And so on this issue, the Republican platform says that Republicans will shift resources back to at-home senior care, overturn disincentives that lead to shortages of home care workers, and support unpaid family caregivers through tax credits and reduced red tape. So that statement's pretty general, could mean different things to different people.
So how would Kamala Harris approach this topic?
So last week, Kamala Harris presented a new plan that would create a home care benefit for Medicare beneficiaries who need help with activities of daily living, like bathing, eating, and dressing, or who have serious cognitive impairments like Alzheimer's. And she calls this plan Medicare at Home, and it focuses on having Medicare cover costs of home care services and nurses. The new benefit would include cost-sharing requirements varying by income. And KFF has estimated that 14.7 million Medicare beneficiaries would potentially be eligible. So, of course, expanding Medicare coverage to that extent would come with a big price tag. Programs that have been proposed like this in the past have been estimated to cost about $40 billion a year before accounting for potential savings from reduced use of hospital and nursing home care. It's interesting that Kamala Harris actually linked this proposal to the prescription drug price negotiations we were just talking about by presenting the prescription drug negotiations as a pay-for. She said that most of the costs for Medicare at Home would be paid for by expanding the drug price negotiations to cover more medications and increasing the discounts that pharma companies would provide for some brand name drugs in Medicare, and also taking action against Medicare fraud. And the plan would also require pharmacy benefit managers who negotiate drug prices on behalf of insurers to reveal more information about drug costs. And Harris is framing the plan as a benefit to help not only seniors, but also the sandwich generation of adults who are both caring for aging parents at the same time they're taking care of their own children.
Okay, and finally, there's been some talking points during the presidential campaign on the issue of reproductive health. Can you give us a snapshot of where the candidates stand on this topic?
Sure. Just by way of context, when Donald Trump was president, he nominated 3 conservative Supreme Court justices, and the Supreme Court overturned Roe v. Wade in 2022. And that Supreme Court decision ruled that abortion was no longer a right under the U.S. Constitution, and it turned over decision-making authority on abortion policy back to the states. And Vice President Harris has made this issue a big part of her campaign. She wants to restore the national right to abortion, and she wants abortion access to be protected until fetal viability, which is generally considered to be about 23, 24 weeks of gestation. Donald Trump, on the other hand, says that abortion policy should be decided by the states. And he says he would veto proposed legislation that would establish a national ban on abortion starting at 15 weeks.
And IVF has also been a topic on this campaign trail. Is that correct?
That's right. So access to in vitro fertilization, or IVF, has gotten a lot of attention this election cycle after the Alabama Supreme Court ruled that frozen embryos should be considered children. Kamala Harris supports a Senate bill that would establish rights for people to access in vitro fertilization nationwide. Her running mate, Tim Walz, has been quite outspoken on this issue and strongly supports full access to IVF. So the candidates seem, at least in principle, to be in agreement about access to IVF. Former President Trump says he opposes efforts to limit IVF. In fact, he says he supports providing full coverage of IVF either through the federal government or by insurance companies. He hasn't provided the details on how that would work.
All right, Ellen, thanks for joining us today on Health Affairs This Week. Got to talk about the topics, the health-related topics for the 2024 presidential election. Thanks for joining us today on Health Affairs This Week. If you, the listener, enjoyed this episode, please send it to the undecided voter in your life, and we'll see you next week. Thanks.
Thanks so much, Jeff.